Those flu-like symptoms you're experiencing might not actually be the flu, and knowing the difference can help you when it comes to getting better. So for more on this, I want to bring in Dr. Ken Redcross. He is a board-certified internal medicine physician. Dr. Redcross, so good to have you.
Thank you, Lynn. It's wonderful to be here.
You know, you say a lot of people are guilty of self-diagnosis, and that's not only dangerous, but it actually can be costly as well.
It absolutely can. You know, it's interesting. That's all because of my buddy, Dr. Google. Now, look, Lynn. Look, Lynn. He's a smart guy. And he means well, but he doesn't know you or know any of the patients out there. So that's the only thing. You're right. You need to be careful with that. So make sure you always speak to your physician first.
So you may actually Google something, think you have it, and it be costlier if you actually went to your doctor and just figured out what was wrong, because maybe you wait too long and then it gets worse. There are 3 common viruses that you talk about around this season that people should look out for.
Yeah, you know, I wanted everyone to really be virus vigilant. As we all brace for the flu season, I just wanted us to keep in mind that there's some other viruses out there as well that can cause problems. I also wanted us to make sure we touch on the signs, the symptoms, some intervention steps, and maybe the duration as well. It becomes very important.
So what are those 3?
Well, the first thing we want to think about is that of influenza. So influenza causes our economy $87 billion each and every year, which results in about 31 million patient visits to my office and doctors all across the United States. But the other thing that's important to understand is that the flu season is a little bit longer than we all thought. It's actually October to May. So you can't really let your hair down when the year is over, the new year comes along. Now, the other thing that's important is getting to your doctor as soon as you can. Within 48 hours or so, Lynn, you can actually come to the doctor and we can write a prescription, but sometimes you don't get there in time. That's why I like to talk about homeopathic ingredients such as oscillococcinum. It's been shown to decrease the severity and the duration of flu-like symptoms. So
that's some of what you have here.
Absolutely.
And is that something that you would use when it's not actually the flu, it's another virus that
It's actually when you feel flu-like symptoms coming on is the best time. In fact, the study showed that 60% of people, when they took it within the first 24 hours, felt better within the next 48 hours.
And
so
what
it was a big
are the
deal.
other 2 viruses that it could be, but you mistake it for the flu?
Now, the thing that kind of ties all of these together is that they all can present with fever. So one is also called the stomach flu. I brought it in, Lynn, because there's actually no relationship to the flu at all, but we all say that, and that is the Norovirus. Now, that's the virus that shuts everything down, right? Cruise ships, nurseries, that sort of thing, because it's highly infectious. The manifestation here, nausea, vomiting, and diarrhea. Because it's so infectious, it's important to do a couple of things. Number one, you want to make sure that you have water on board or something to actually replenish your fluids and your electrolytes. I have this soap here just to remind us, Lynn, that mom is always right. Because mom says, wash your hands.
Exactly.
And she is right, because you have to wash your hands. And the old adage of saying happy birthday to me, it actually works, and it's important. So not only that, half of people can also have fever. So we have influenza with fever, we have the norovirus that can have fever, and then last but not least, we have the Coxsackie virus. Now that comes from my home state in New York. Coxsackie, New York is where it was first discovered. I brought it in this time because it's the cause of hand, foot, and mouth disease, which you see in kids under the age of 10 typically. But last week, there was a outbreak in Florida State University, and the college kids actually came down with hand, foot, and mouth disease. Once again, presents with fever as well. I have these things here to remind us.
Why yogurt?
I have yogurt here because it's actually 2 purposes. Number 1, it helps to cool the body as well. But number 2, probiotic. We now understand the importance of probiotic for our immune system at baseline. I have the washcloths to also remind us that it's not only about Tylenol or ibuprofen to lower our temperature, but think about cool compresses to the forehead, the back of the neck, to also decrease the body temperature.
Some great advice, because, you know, we all Google. We're guilty of it, but this is actually the things we should be focusing on. Dr. Ken Redcross, so wonderful to have you.
Thanks for having me on, Lynn.
We appreciate it.
Stay healthy.
Take care.